I'm presenting on association between hypertension and triglyceride glucose index in BRBO. There is no financial disclosure. Retinal vein occlusion leads to notable vision loss and rank as the second most common vascular ailment affecting the retina in more than 16 million people globally. It can be classified in two subtypes depending on the site of the obstructed blood vessel, BRBO and CRBO. BRBO, with an annual incidence of 2.14 by 1000 in the population over 40 years of age, exhibits a higher prevalence compared to CRBO. Population-based studies report a prevalence rate of 0.5 to 2% for BRBO and 0.1 to 0.2% for CRBO. The risk factors associated with BRBO are advancing age, hypertension, diabetes mellitus, dyslipidemia, cardiovascular disease, hypercoagulability, oral contraceptives, pregnancy, and ocular factors such as intraocular hypertension or glaucoma. Patients with long-standing arterial hypertension undergo retinal artery atherosclerosis characterized by intimal layer thickening, medial layer hyperplasia, and arterial wall hyaline degeneration. There is compression of vein at the AV crossing, leading to abnormal hematological factor and degenerative changes in the vessel wall. The consequences of venous occlusion are intraretinal hemorrhages, macular edema, and ischemia. My study was a hospital-based case control observational study which included patients with 67 patients with newly diagnosed acute stage of BRBO, and they were compared with 70 healthy control groups matched for age and gender. The mean age was 61.2 plus minus 8.4 years in group 1 and 60.4 plus minus 10.1 in group 2. My exclusion criteria were serious cardiovascular disease, COPD, anemia, history of uveitis, scleritis or retinal diseases, and coagulopathies. In recent years, it has been reported that triglyceride glucose index, calculated as a log of fasting triglyceride into fasting glucose divided by 2, is a simple and reliable marker for the determination of insulin resistance and atherosclerosis. It has been shown that high triglyceride glucose index is associated with high arterial stiffness, and the triglyceride index has a clinical significance in the evaluation of microvascular damage. Triglyceride glucose index can be a new useful indicator in development of BRBO. Detailed diabetic and hypertensive status of the patients were included in my study, family history, personal history, and detailed ophthalmic examination using breast corrected visual acuity by refraction slit lamp examination. Detailed fundus evaluation were done, and blood investigations were done in the study of fasting blood sugar, HbA1c, and serum lipid profile. The statistical analysis was conducted using SPS version 2022. This is the OCT picture showing BRBO. In BRBO group, maximum patient belong to the age group of 60 to 64 years, followed by 55 to 59 years, and the control group, maximum people were in the age group of 60 to 64 years. In BRBO group, there were 36 males and 31 females, and in control group, there were 38 males and 32 females. In the BRBO, the maximum patient having systolic blood pressure in the range of 130 to 140 mmHg. And in control group, they were having maximum people were having pressure between 110 to 120 mmHg, and diastolic blood pressure in the BRBO group maximum were having 80 to 85 mmHg, and control group they were having 75 to 80 mmHg, and in BRBO group most of the patients are having fasting blood sugar level up to 100, and in control group also maximum having with 100. HbA1c in BRBO group, they were up to 6.4%, and control group 64 patients. In BRBO group, maximum were having triglyceride in the range of 150 to 199, and in control group, they were less than 150. So thus my result was that the group showed no significant difference in average age and gender distribution. The BRBO showed significant difference in terms of hypertension compared to control group, and BRBO exhibited higher triglyceride level compared to control group, and triglyceride index was significantly higher in BRBO when compared to control group. So according to Paul R.A. conducted study RBO, the study showed the risk factor for RBO attributed to hypertension was 47.9%, and diabetes was 4.9%, hyperlipidemia was 20%. So various biomarkers have been investigated in predicting the atherosclerosis, and the clinical use has been evaluated. Triglyceride glucose index is a valuable marker. Another predisposing factor as well as known atherosclerosis and hypertension. In B1MI study, hypertension was associated with prevalence of BRBO. In recent years, numerous extensive prospective cohort studies have confirmed the strong association between triglyceride glucose index and hypertension, and a meta-analysis determined that triglyceride glucose index is a useful predictor for risk of developing hypertension among general adult population. Hypertension is a significant risk factor in BRBO, substantially contributes to atherosclerosis development. And triglyceride index may serve as a tool to identify vessel wall degeneration and AV compression caused by hypertension. These are my differences. Thank you.
Very nice presentation, doctor. But so do tell me, how do you think this is going to be useful in our day-to-day practice?
So because we argue the risk factors is triglyceride and diabetes. So if we calculate so the index will tell about the microvascular damage.
So patients, when they report to us, we've already had a branch retinal vein occlusion. So it can't be used as a screening tool per se. It does give us information, like you said, that my patients with BRVO had high levels of triglyceride glucose. But the relevance in practice is somewhat. Another advice to you is that your study is very good, but your slides are too crowded. You should keep them minimum, and you should elaborate more on whatever you've written rather than putting paragraphs in writing.
More cases should have been shown pictorially. It was only one picture.
Does it anyway affect patient going into systemic hypertension, as Dr. Piyush asked? How is it going to help the patient? Just that you are adding one more test. Any patient with BRVO comes, we say get your blood pressure checked, sugar, lipids profile. So we will add one more test to that. That's all. Or do you think there is any other importance of this biomarker?
Did you study the nocturnal hypertension also as well?
No.